Is your persistent itch more than skin deep? For seniors, it could be a silent red flag signaling serious health issues. Discover the 4 key spots and what they mean before it's too late. Have you ever had an itch that made you wonder what your body was saying? As we age, our body speaks subtly through aches, fatigue, or even itchiness, while most people shrug off a little itch as nothing more than dry skin or a passing irritation. The truth is, where that itch shows up on your body might be revealing far more than you think. In fact, certain areas of chronic itchiness in seniors have been linked to serious underlying health problems that could silently shorten your lifespan. That's right. Something as simple as a persistent itch could be your body waving a red flag, warning you that it's time to pay closer attention. In this video, we're going to uncover 4 specific areas on the body where itchiness in older adults could be a signal of deeper health concerns. These aren't just guesses or old wives' tales. They're based on real patterns observed by doctors and researchers who've studied aging and longevity. Each of these itchy spots has a unique story to tell about your blood flow, your organs, your nerves, and even your nutrition. And by the time we reach the end of this video, you'll know how to recognize these warning signs and what steps you can take to stay ahead of them. So don't brush it off. Stay with us until the end, because understanding what your body is trying to say might not only help you add years to your life, it might help you live those years with more strength, clarity, and peace of mind. Let's begin. Number 1, persistent itchiness on the lower legs. One of the most overlooked but telling signs that something deeper may be going on in your body is a constant itch on the lower legs. It's easy to chalk it up to dry skin or aging, but when this area becomes noticeably itchy without any visible rash or irritation, it might be time to take a closer look. Doctors have found that older adults who frequently scratch their calves, shins, or ankles may be experiencing poor circulation, specifically a condition known as peripheral artery disease. This means the blood isn't flowing as freely through the small vessels in your lower limbs, and that limited circulation can cause the skin to become dry, sensitive, and unusually itchy. To expand on this, peripheral artery disease, or PAD, is a common circulatory problem where narrowed arteries reduce blood flow to the limbs, often leading to symptoms like leg pain when walking, known as claudication, but also skin changes, including persistent itching. This condition affects millions of older adults, and if left unchecked, it can progress to more severe issues like non-healing wounds or even amputation risks. The itching arises because poor blood flow deprives the skin of oxygen and nutrients, making it more prone to irritation and inflammation. In fact, related conditions like chronic venous insufficiency can also contribute, where blood pools in the lower legs, causing venous stasis. Dermatitis, a form of itchy, dry skin that often appears reddish or scaly. This isn't just cosmetic. It's a sign that the veins are struggling to return blood to the heart, putting extra pressure on the skin and underlying tissues. Studies show that itch in the legs is strongly associated with the severity of venous disease, and it often correlates with pain and reduced quality of life. For seniors, this can be exacerbated by factors like prolonged sitting, obesity, or a history of smoking, which further impair circulation. Recognizing this early is crucial because PAD is linked to broader cardiovascular risks, including heart attacks and strokes, as the same plaque buildup affecting leg arteries can impact coronary arteries too. Now let's think about 2 men, Harold and Dennis, both in their early 80s. Harold enjoys taking short walks around his neighborhood every morning. He stays active, checks his feet and legs regularly, and hasn't noticed anything unusual. Dennis, on the other hand, has been less mobile these days, He's been feeling tired more often, sits for long stretches and has started noticing a persistent itch creeping up his legs, mostly at night or after sitting for a long while he applies lotion, thinking it's just dry skin, but it doesn't really help. What Dennis doesn't know is that this itching could be his body's way of signaling that the blood isn't reaching the lower part of his legs as efficiently as it used to. When your legs aren't getting proper circulation, not only does the skin dry out, but the muscles and tissues also start to weaken over time. This puts extra strain on your heart, your veins, and your entire vascular system, and poor circulation has been linked to higher risks of heart disease, stroke, and even cognitive decline. The legs are often called the second heart because they play such a big role in helping pump blood back up to the rest of the body. If they're struggling, your whole system can suffer. But here's the good news: this kind of itchiness can be managed and even reversed if caught early. Movement is one of the best medicines. Gentle leg exercises, regular short walks, and elevating your feet when sitting can all help improve blood flow. Staying hydrated, wearing comfortable compression socks, and cutting down on salty foods can also make a big difference. To build on these recommendations, medical experts suggest starting with lifestyle changes before escalating to treatments like medications or procedures. For instance, walking programs have been shown to improve symptoms in PAD patients by promoting collateral circulation, where new blood vessels form to bypass blockages. Compression therapy helps by gently squeezing the legs to aid venous return, but it's important to get fitted properly to avoid discomfort. Hydration supports overall blood viscosity, making it easier for blood to flow, while a low-sodium diet reduces fluid retention that can worsen swelling and itching. If symptoms persist, diagnostic tests like ankle brachial index, ABI, can measure blood pressure differences between arms and legs to confirm PAD. Additionally, addressing underlying causes such as high cholesterol or diabetes through diet and medication can halt progression. For venous issues, topical treatments for stasis dermatitis, like steroid creams, may provide relief, but always under medical supervision to prevent skin thinning in older adults. Incorporating anti-itch strategies such as cool compresses or oatmeal baths can soothe the skin while you work on the root cause. Remember, early intervention not only alleviates the itch, but can significantly lower the risk of complications, allowing seniors to maintain mobility and independence longer. If you've been noticing an itch in your lower legs that just doesn't seem to go away, especially when there's no rash or allergy, don't ignore it. Your body might be trying to get your attention in the only way it knows how. Now, number 2, unexplained itching on the upper or mid-back. An itch in the middle of your back can be hard to reach, but what if it's trying to reach you with a message that matters? Many older adults experience persistent itchiness on the upper or mid-back, and while it's tempting to blame it on dry skin or an old shirt tag, this kind of itch often points to something much deeper. In fact, one of the lesser-known but serious causes of upper back itchiness is a problem with the liver or kidneys, 2 of the most vital organs responsible for filtering toxins from the body and maintaining internal balance. When these organs are struggling, waste products can build up in the bloodstream, irritating the skin and causing it to itch, especially in places like the back where there's a high concentration of nerve endings. Diving deeper, this type of itching is often referred to as pruritus, and in the context of kidney issues, it's known as uremic pruritus, which occurs due to the accumulation of uremic toxins in the blood when kidneys fail to filter them properly. This is particularly common in older adults with chronic kidney disease, CKD, where itching can be severe and generalized but often affects the back, arms, and legs. For liver problems, Itching is linked to cholestasis, where bile salts build up in the skin, causing intense pruritus without a rash. Conditions like cirrhosis or hepatitis can trigger this, and it's more prevalent in seniors due to age-related decline in organ function or medication side effects. Research indicates that pruritus in the elderly can also stem from drug-induced liver or kidney strain, emphasizing the need to review polypharmacy in this age group. The itch is typically worse at night, leading to sleep disturbances that further impact health. Importantly, while dry skin, xerosis, is the most common cause of itching in seniors, especially in winter, underlying systemic issues like these should be ruled out if topical remedies fail. Screening for kidney disease is recommended for those over 65, as extremely itchy skin can be an early warning sign. Take Dorothy and Janice, both 76 years old. Dorothy gets regular checkups, drinks plenty of water, and has always had good skin. Janice, however, has recently been feeling more tired than usual, notice some swelling in her ankles, and has started scratching her back more often. Especially at night, she's tried changing her laundry detergent and moisturizing regularly, but the itch remains. What Janice doesn't realize is that this constant itch could be her body's way of signaling that her kidneys are under strain or that her liver isn't processing toxins as effectively as before, and when these organs aren't functioning properly, it can affect everything from digestion and sleep to energy levels and mental clarity. Itchy skin caused by liver or kidney dysfunction is typically persistent, doesn't respond to usual remedies, and often appears without any rash. It's also more likely to occur at night, making sleep difficult and draining your energy even more. And while it might seem unrelated, this kind of chronic itching has been linked to shortened lifespan in older adults, not because the itching itself is dangerous, but because of what it represents: a deeper imbalance that could be quietly worsening. But this isn't a reason to panic, it's a reason to check in with your body. A simple blood test can often reveal how well your liver and kidneys are working. Staying hydrated, eating a diet low in processed foods, reducing alcohol intake, and watching your salt levels can help ease the burden on these organs. If you're taking multiple medications, it's also wise to talk to your doctor about their impact on your liver and kidneys. Enhancing these steps for kidney-related itching, treatments may include phosphate binders or UV phototherapy if dialysis is involved. But for non-dialysis patients, optimizing hydration and using emollients can help. For liver issues, medications like cholestyramine can bind bile salts to reduce itching, and avoiding alcohol is key to prevent further damage. Regular monitoring through blood tests for creatinine, kidney function, and liver enzymes can catch problems early. Dietary adjustments, such as increasing fiber and reducing protein if kidneys are impaired, support organ health. In seniors, addressing comorbidities like diabetes or hypertension is vital, as they accelerate organ decline. Non-pharmacological approaches, like cool showers or antihistamines, provide symptomatic relief, but the focus should be on treating the underlying cause to improve overall prognosis and quality of life. So the next time your back starts itching for no clear reason, stop and listen. Your skin might be the first place your body shows signs of internal stress. Now, let's move forward. Number 3, frequent itching on the scalp or neck. When older adults begin experiencing persistent itchiness on the scalp or back of the neck, it's often mistaken for something trivial. Maybe dry skin, maybe a reaction to shampoo, maybe just part of aging, but there's more going on beneath the surface. For many seniors, this kind of itch isn't just about skin, it's tied to something deeper: stress, inflammation, and in some cases changes in the nervous system that can affect both physical and mental resilience. The nerves around the scalp and neck are highly sensitive, and they're often the first to react when the body's under strain, especially emotional or neurological strain that's been building slowly over time. To elaborate, this can manifest as neuropathic itch, which stems from nerve damage or dysfunction rather than skin issues, often feeling like burning, tingling, or crawling sensations. In seniors, it's linked to conditions like neurodermatitis, where chronic scratching creates thick, scaly patches exacerbated by stress. Stress elevates cortisol, which can inflame nerves and worsen itching, particularly in sensitive areas like the scalp. Common triggers include peripheral neuropathy from diabetes or vitamin deficiencies, or even cervical spine issues compressing nerves, leading to brachioradial pruritus-like symptoms in the arms and neck. Scalp pruritus without visible causes is distressing and may indicate underlying psoriasis, seborrheic dermatitis, or systemic factors like anxiety. In the elderly, assessment should include ruling out allergens, but focus on neurological and psychological aspects for comprehensive management. Let's take two men, Leonard and Red, both in their late 70s. Leonard stays socially engaged, spends time gardening, and practices light meditation in the evenings. He's always had a relaxed way about him. Ree, on the other hand, has had a tougher time adjusting to retirement. He feels restless at night, spends more time indoors, and has been carrying a lot of quiet stress without even realizing it. Over the past few months, Ray began scratching his head more often, first just in the evenings, then throughout the day. No rash, no flakes, no real explanation. He tried switching shampoos and bought a new pillowcase, but nothing helped. What Ray didn't know is that this itch was likely a physical expression of emotional tension and nervous system fatigue. As we age, our stress response becomes less efficient. Instead of calming down after a moment of worry, the body tends to stay in a low-grade state of alert, keeping cortisol levels high and immune function suppressed. That tension often gets expressed in the most sensitive nerve endings, like those found on the SC and back of the neck. Chronic itching in this area has also been linked to conditions like neuropathy and even early signs of cognitive decline. That doesn't mean it's always something serious, but it does mean it should never be brushed off. The good news is there are ways to calm the nervous system and ease that itch. Simple breathing exercises, spending time outside, reconnecting with friends, or even just journaling a few thoughts before bed can help regulate the body's stress signals. In Ray's case, when he started making small changes, going for a short walk in the morning, turning off the news after dinner, and calling his brother once a week, he noticed the itching faded. Not overnight, but gradually, as the tension lifted from his shoulders and his thoughts began to settle. Building upon these strategies, treatments for neuropathic itch may include gabapentin or pregabalin to modulate nerve signals, or topical capsaicin to desensitize nerves. Stress management techniques like mindfulness meditation have evidence-based benefits in reducing cortisol and alleviating symptoms. For scalp-specific issues, gentle shampoos with ketoconazole can address inflammation if fungal elements are involved, but neurological evaluation is key for persistent cases. Seniors should consider vitamin B12 levels, as deficiencies can mimic neuropathy. Combining lifestyle changes with medical input can break the itch-scratch cycle, preventing skin damage and improving mental well-being. If you've been dealing with an itch on your head or neck that won't go away, and you've ruled out skin conditions or allergies, take a deeper look. Ask yourself how you've really been feeling lately. Physically, yes, but emotionally too, because your body isn't just reacting to what you put on the outside, it's responding to what you carry on the inside, and sometimes that persistent little itch is your nervous system tapping you on the shoulder asking for a little piece. Number 4, ongoing itching around the chest or abdomen. When people think about signs of declining health, they usually imagine things like shortness of breath, dizziness, or memory problems, but the skin on your chest and belly, yes, right across the front of your body, can quietly speak volumes about what's happening inside, especially when it starts to itch without any clear cause. Older adults who frequently experience itchiness across their torso, particularly in the chest or abdominal area, may be facing more than a minor skin issue. This kind of itching is often a red flag for nutritional deficiencies or malabsorption problems, both of which can silently wear down your body's strength, immune defenses, and ability to repair itself. Expanding this, nutritional deficiencies in seniors can lead to pruritus due to impaired skin barrier function. For example, vitamin B3, niacin deficiency causes pellagra, featuring dermatitis with itching, often on sun-exposed areas, but can affect the torso. Vitamin B6 deficiency manifests as eczema or seborrheic dermatitis, contributing to itchy patches. Zinc and vitamin A shortages also promote dry, itchy skin, while malabsorption from gastrointestinal issues exacerbates these. In the elderly, factors like reduced appetite, medication interference, or chronic diseases increase risk, and itch can be a subtle sign before overt symptoms appear. Xerosis remains common, but systemic deficiencies should be considered if itching persists. Let's look at 2 women, Joyce and Elaine, both 81 years old. Joyce still enjoys preparing her own meal, making colorful plates with fruits, greens, and a bit of protein. She doesn't eat as much as she did when she was younger, but she makes sure her food counts. Elaine, however, has slowly lost interest in food over the past year. She finds herself skipping meals, reaching for crackers or canned soup, and feeling full quickly. Along the way, she started to notice that her chest and belly itched more often, especially in the evenings, and sometimes even felt a bit tender or dry. She assumed it was just sensitive skin and tried switching body washes, but nothing helped. What Elaine didn't know is that as we age, the digestive system can become less efficient at absorbing key nutrients, especially vitamins like B12, essential fatty acids, and trace minerals like zinc and magnesium. When the body doesn't get enough of these, the skin starts to dry out, nerve signals become erratic, and the immune system weakens. The result, areas like the torso, which are dense with nerve endings and blood vessels, become sensitive, irritated, and itchy. But more importantly, these internal deficiencies quietly affect muscle strength, energy levels, and even the brain's ability to stay sharp. The most dangerous part of malnutrition in seniors is that it often hides behind a normal-looking weight. You might not be losing pounds, but your body could still be starving for what it needs to maintain itself. That's why persistent itchiness in this central part of your body can be more than just an annoyance, can be an early sign that your engine is running low on the fuel it needs to keep going strong. The encouraging part is that this is one of the most fixable issues on this list. Improving your nutrition doesn't require complicated changes. Simple additions like a handful of nuts, a boiled egg, some fresh berries, or even a quality multivitamin can work wonders over time. To further address this, blood tests for nutrient levels, such as serum B12, folate, and zinc, can guide supplementation. Dietary interventions focusing on whole foods, leafy greens for vitamins, Fatty fish for omega-3s help restore balance. For malabsorption, consulting a gastroenterologist may reveal issues like celiac disease or atrophic gastritis common in seniors. Topical moisturizers with ceramides support skin health while nutrients rebuild from within. Preventive screening for deficiencies is especially important in those over 65, as early correction can prevent cascading effects on immunity and cognition. If you've been noticing itchiness across your chest or belly and haven't been eating as well as you used to, consider this your gentle reminder to nourish yourself not just for comfort but for longevity now. Let's move forward. Final thoughts. Now that you've learned about these 4 specific itchy spots on the body, take a quiet moment and ask yourself, have you noticed any of these signs lately? An itch here and there might seem like nothing, but as we've seen, each one can hold deeper meaning, from poor circulation in the legs to signals of liver or kidney strain from stress worn into the nerves of the scalp to subtle signs of nutritional gaps across the chest and abdomen. Your body is always trying to speak to you. It doesn't shout, it whispers, and those whispers often come through the skin. The important thing to remember is that none of these signs mean your fate is sealed. In fact, every one of them offers an invitation to check in, slow down, and give your body what it needs before a small warning becomes a bigger problem. You can walk a little more, you can eat a little better, you can rest a little deeper, and you can reconnect with yourself and with others. If even one of these signs felt familiar to you today, don't ignore it. Start with one small change, and if you didn't recognize any of them, that's even better. But now you know what to watch for and what do if things begin to shift, because the goal isn't just to live longer, it's to live longer with clarity, independence, and joy. Listening to your body's early signals, even the ones that itch, is one of the smartest ways to do just that. Thanks for watching, and we look forward to seeing you in the next video.